Ruba, and today is a little bit different. I'm actually in my office. Um, and I wanted to show you guys a few things in a GYN's office and answer some questions. So I'm really excited about that. We'll wait for a few more people to join in, and then we will get started. Today, my chai is actually some water. um, so, wherever you're joining in from, grab your chai and join us. And, for the next few minutes while we take a look at some things around the office. And I would love to answer questions as well. Okay. All right. Okay, so hi everybody. I am Dr. Chiruba Prabhakar. I'm an OBGYN in the Bay Area in California, and really excited for this episode of Chai with Chiruba because it's not just information. I'm actually in my office in one of my exam rooms. So I'm going to show you a few things and just break down some common misconceptions. And I would love to answer some questions. Okay, so I wanted to first show you a few things. I'm going to roll around in this office. I'm sitting in like a rolly chair. One of the things that most women are very afraid of in the gynecologist's office is a speculum. So, and many women don't even know what a speculum is, especially younger women who are coming in for an issue, or maybe this is their first PAP and they don't know what to expect. So I wanted to show you what a speculum looks like. So this is a speculum, and it looks scary, but it's actually it's not painful, but it's definitely uncomfortable. So if you can think about this, this is a speculum. It goes right in and it opens to be able to see the cervix, which is the opening into the uterine cavity, and that's where we take our little pap from. So we put this in, we open, we can see, we have a light, we can see at the cervix, and then we scrape some cells off the cervix. It takes about 10 seconds. I'll show you some of our brushes. 1 second. Okay, so we have some brushes here, and once we open the speculum and take a look at the cervix, we can just use this brush right here and this brush to go and take some cells. And we put this in a little container and it goes off to the lab to look at the cervical cells and make sure that there's no cancerous cells. So this is what a speculum looks like, and there are many different sizes. So we have really tiny ones called pediatric speculums. So they're really tiny compared to like an average size. So you can see that there. So if it's a young girl coming in for first exam or the first PAP, or some adults even who are, find this whole thing very nerve-wracking and they want a very, very tiny speculum, we have that in our office. There's a question before about plastic versus metal speculums. Overall, I've used both in my career, and I have found that the metal speculums are actually way more comfortable than the plastic ones. They don't make any noise as you open them. Plastic ones click as you open, and that can be scary for many. So I personally stick to these, and they're also environmentally more sustainable. These can be cleaned and autoclaved and sterilized and used again versus contributing to more waste. So that's that. That's what I wanted to show you guys about a PAP test and what a speculum is like. And then we have a couple of other tests when women come in for yeast infection, or maybe they have itching, they have discharge, and they want to see what's going on, we do another type of swab. So we have this swab right here, and we take it out and we swab the vagina, and we swab the discharge, and we send it to the lab to make sure that they, to see if they have a yeast infection or BV or some other infection. We do have a self swab. I've been talking a lot about that in the past. This is our self swab. So literally we break this off. It's like the old school COVID test. You take this, you put it in the vagina, and you twirl it around for 20 seconds, and we send this off to the lab. And so this screens for HPV, which is a screen for cervical cancer. And the great thing is I give this to the patient and they do it themselves. And so no speculum needed, no doctor's intervention needed. So that's really great. I wanted to show you what a colposcope looks like. So I'm going to wheel over here, and this is a colposcope. Let's move it right here. Okay. Hopefully you guys can see that. So this is a machine. It's like a microscope that we use to take a look at the cervix when somebody has an abnormal pap. So if you have a high risk strain HPV, you have an abnormal pap, we ask you to come back for a colposcopy. And this is what it's like. So first we put a speculum, and we prepare the cervix to be visualized, and then we hook this up and we take a look right here, and then based on what we see on the other end, we then take some biopsies off the cervix. So if you have had an abnormal pap and you're asked to come in for more testing, this is what you're looking at. So it is not an invasive test. This is really a microscope that looks closer into the cervix. And then we also do ultrasounds in the office, or we send patients for ultrasounds to the radiologist for fibroids, abnormal bleeding, maybe you have an ovarian cyst, all sorts of things. And for a gynecologic ultrasound, we really prefer a pelvic ultrasound. So or a transvaginal ultrasound. So we can really look at the uterus and the ovaries much more closely. So this is what that machine looks like. So this is a very portable ultrasound. If you were to go to a hospital or an ultrasound facility, you may see something a lot more bigger, a lot more big, and more fancy. This is just a quick office ultrasound. But this is pretty much the probe that goes into the vagina. So this is what it looks like. Many patients call it the wand, but there's a condom that goes over it with some lube, and then this goes into the vagina, and this has a transducer at the end, and this can really look very closely at the uterus and the ovaries. So this is what a transvaginal ultrasound looks like. So if you go to the gynecologist and they say, oh, I'm going to send you for an ultrasound, or I'm going to do an ultrasound, this is what they're talking about. If you're pregnant and early in pregnancy, this is also a similar ultrasound that we do. So these are just a few of the things that I wanted to show you around the office. Happy to answer questions as well. Also wanted to show you guys my visual model that I use with my patients all the time, that goes over this. I got this off of Etsy, and I love it because, we didn't learn about these things in sex ed as we should have. So maybe things are different now. But, I show patients where the clitoris is, where the urethra is. This is where you pee from, where the vagina is. Here's the labia. And so labia minora, majora, and here's the anus. So this is a great model, and it just really, I'm all about educating my patients. And, I got this because one time a patient told me that she, was peeing. She definitely felt like it was just one hole and she pees out of her vagina. And it's like, no, it's two holes. And then I showed her, and then I was like, you know what? No one's looking down there and educating themselves on this. We should get one of these. So this has been a great tool in my office. And so I have a lot of visual charts and things that I'm showing patients, because it's really important to see and hear, especially if you don't know anything about these things. It's helpful to get multiple ways to process the information. So I know patients really appreciate it. Okay, so those are the few things that I wanted to show you around the office. I mean, there's so many other things, but these are the most common things that I use with patients during annual exams or when they come in for specific concerns. And so I would love to take any questions. Okay, so let me see. After, okay, does a self swab hurt? No, the self swab does not hurt. I'll actually show you what it actually looks like. So this is the self swab. You break it, and you can see here that the tip is just, kind of a piece of cotton like material, and there is a mark here. There's a red mark that you can see here, and that's how deep it has to go. So it's not like this whole thing has to go in. You just go up to the red mark, and then you just twirl it around for about 20 seconds. You take it out, you put it back in. That's it. And then you're done. So you can do this in the bathroom, at your doctor's office, or in the exam room before the doctor even comes in. And if you're somebody who has no other complaints, like this is your pap test. This is your cervical cancer screen, because this checks for HPV. So it's really, really great. And I've had a lot of women do it with a lot of success. So it does not hurt, and you are in control. Yes, thank you. I love the visual as well. And I feel like it just adds to the conversation. Another really great visual that I show patients is this one. I have this great chart that goes over fibroids and endometriosis and adenomyosis. So this is a really great one that I also show patients, because when you read a medical report or your imaging report, there's all these words. I mean, you can Google them, but it's not like seeing it, in a picture. How are fibroids and endometriosis connected? So about 40% of patients who have fibroids also have endometriosis. Now, they are two separate things entirely. Fibroids are benign tumors of the smooth muscle, and endometriosis is when the glands of the uterine lining start to go into the pelvis. So they're two different things, but they often coexist together. And that's what I see in surgery as well. When I go in for fibroids, I often see endometriosis as well, but they're two completely different etiologies as far as we know at this time. Okay, what other questions? Are adenomyosis and endometriosis similar conditions? Yes, actually. And I'm going to show you this diagram right here. So if you look at these purple glands right here, this is actually adenomyosis. Adenomyosis is when the uterine, the glands of the lining from here start to bury themselves in the wall of the uterus. And when this happens, instead of just the glands from the lining contracting and causing bleeding, the entire muscle of the uterus really comes down almost like a sponge. It stores blood and then it just squeezes down. So often patients with adenomyosis will have a lot more heavy bleeding, bloating, those kinds of symptoms. Okay, you are welcome. Does it really look like that? I'm not sure what you're referring to, but I know I just showed a bunch of things. So, okay. What other questions do you guys have about things around the office, or maybe that you're a gynecologist? Oh, the plushie. Well, it's a visual representation. But the anatomy is what we're going after. And so that's what we're trying to educate patients on. Okay. After myomectomy, how long does it take internally for the uterus to heal? About 6 to 8 weeks. The sutures dissolve in that time frame. So overall, 6 to 8 weeks for the inside to heal. Okay. What are the different areas within an OBGYN office, and what purposes do they serve? Okay, this is a good question. So every office is a little bit different. So the main thing that every office, of course, has is our exam table that you can see over here. Let me get my plushie out. And in our office, we've got this exam table that we can kind of make it go up or down. We have a light attached over here to the exam table. So every office is going to have an exam table, and then in our office we actually have a couch right here that that patients first sit at, or if they're bringing in a friend or a partner, they can sit there too. Often people bring in somebody for support, and so it's just a very inviting, kind of environment. And I always talk to my patients first there before I have them undress for the exam. Now, in some offices, time is tight, so within, you're expected to already undress and like be ready when the doctor comes in. So yeah, so that's kind of our office. We have a little coffee table there, our trash can. We have this little drawer with our supplies. As I showed you, we have some of our other equipment like ultrasound and colposcope. And then outside, we have a reception. I should actually do a tour one time of our entire office. We have a reception outside, and our office is set up very much like, it's not really it's not set up like a medical office. So it's very inviting and cozy. It's not very sterile, because I just don't like that vibe. So yeah, so that's our office. How do OBGYN offices ensure a sterile and safe environment for patients? So all of our, so we, between every patient, we wipe down everything. We wipe down the table. We have special disinfectant wipes that are used for all of that. We make sure we dispose things off of, correctly, like sharps go into the, sharp container. And we have different buckets that our speculums go into. And then we have an autoclave that actually sterilizes all of our metal equipment. So our speculums and other, other things, all our metal like equipment that we use for procedures. Of course, we use gloves all the time. The office is cleaned regularly. So yes, there's a lot of, we have, certain regulatory things to adhere to. So yes. What should a new patient expect during their first visit to an OBGYN office? So depending on how old you are, I mean, for teens who come to me, I don't always do an exam. It really depends why they're there. And it's a lot of just education, showing them these models, asking them, questions, and really answering their questions as well. But if you're above 21, you can expect a PAP. So first, going to your doctor, I get a full history, your personal history, family history, medications, allergies, all those things. And then for the exam, for a GYN exam, we always do a breast exam, and then a pelvic exam, including a speculum exam, including this exam where we're looking at the cervix, looking at the vaginal canal. And then the rest of the exam really depends on the patient's specific questions or concerns. Well, that's about a typical GYN exam. So it's a lot of talking, and then of course a focused exam. All right. I will take one more question if anybody has it. And otherwise, this was so much fun. I hope you guys learned a lot, and I will see you next Thursday. At 8:30, we will do chai with Chiruba again. And please tag a friend or share this video with someone that could use it and could learn from this. And if you're in the Bay Area and you're looking for a gynecologist, come see us in Lafayette. And we'd love to see you for a consult or exam or surgical concern. Yeah, and we will see you later. Bye, everybody. Thanks for joining me.